This is Into Healing, and I'm your host, Mira Adura. Today's Into Healing guest is Dr. Heiner Fruehauf. Heiner is a professor, visionary thought leader, and classical Chinese medicine practitioner. In this episode, we cover his own early cancer diagnosis, which led him to holistic medicine, and how he navigates the realm of body, energy, and consciousness. Heiner believes that 21st century humans can and must support their healing in harmony with nature. If you enjoyed this episode, please like, subscribe, and follow us for more transformational healing stories. Heiner, I'm so grateful you're here. Thank you for being with us.
Thank you so much for inviting me.
So you studied East Asian languages and civilizations. How did you find your calling as a healer?
Well, I was born in Germany into a strict German patriarchic family, and they were all in medicine. And as the oldest son of the oldest son of the oldest son, in the 1970s, I decided I wanted to do something completely different and wanted to study something more artistic. I enrolled in comparative literature studies and Chinese language and history studies, and that was just a minor. But after a week at school, I immediately made that a major. I felt like that was my real calling, and then very soon went to China when it had just opened in 1982. There were only 100 non-Chinese people at Fudan University in Shanghai at the time. Now there is about 250,000 expats living in that city, so it was a very unique opportunity with people all over the world. I met my American wife there, and that brought me to the United States, got my PhD. But in that year, when I had already a professorship lined up to teach literature, I got cancer as a young man, completely unexpectedly. I considered that an inconvenience because I was very close to graduating, and after almost 10 years of investment into my academic career there, I just went to the hospital and they said, oh, it's a small surgery. I was diagnosed with testicular cancer at the time, which is a typical young man cancer. And so the surgeon said, oh, well, this is 10-minute surgery. It's not a problem. And so not only was it a problem, the pain never went away. I was 3 weeks on my back and immediately took a timeout because I was aware that there was something that was not just a genetic flaw, but some kind of a sign that I need to reevaluate my life path at that time. And so I went back to China mostly for self-healing purposes. While I was in China the first time from 1982 to 84 in Shanghai, when I had a problem or so, health-wise, I would also seek out Chinese modalities. So there was that kind of a natural interest in that field.
You know, it's so interesting, you getting cancer and taking it upon yourself to go to China to heal yourself, where normally when somebody would have a disease of some sort, especially something like cancer, at least in this country, you automatically turn to Western medicine. What was the drive for you? Is it because you were around these Western doctors that had more nature-inspired healing modalities that you felt called to go to China?
It was actually the very negative experience in the hospital. In 5 minutes, a decision was made what kind of therapy I was to receive later, which was primarily following the surgery was radiation to the remaining testicle at age 28, when we still wanted to have more children. We had one son at the time, and there was a 50% or more chance that wouldn't be possible anymore. And there wasn't any option or discussion about that, or it was even frowned upon that I wanted to have a second opinion. And so I fell back on two things. Number one, on just knowing from my childhood that there were other ways possibly. And so I sought out, number two, a Korean female acupuncturist on Lawrence Avenue in North Chicago in Koreatown, and she would mix the herbs by hands. She said, your pulses are perfectly fine. They come right back after the treatment. The radiation is just going to weaken you more and compromise you for the next, 30 years to come or so. If I wouldn't have run into her, I might not have, with my relatives being far away on another continent, I might not have had the courage to say no. The narrative was, if you don't do the follow-up treatment, you'll be dead in 2 years. And there was a real aggressive anger response where I was being told originally that the radiation was just it's like a day in the sun, and it's, what are you worried about? And when I said I'm not actually going to do it, the answer was from the doctor, from the oncologist, was, you've already had 2 CT scans, you'll have more radiation in your body than I will ever have. You basically already damaged goods. To get additional radiation treatment is actually that's it's not going to make it that much worse than it already is. And at that moment, I felt like, this is crazy. I need to take care of myself, because I never want to go back to the hospital again. It was a kind of trauma, really, which at sort of the pinnacle, when I finally, after all this investment, already had an assistant professorship at a very good East Coast university lined up to teach, that I let that go and started basically what became a second education at Chengdu University of Traditional Chinese Medicine Pharmacology, which is China's oldest academic institution for the study of Chinese medicine, which was at the time just a hobby. I wanted to understand the medicine better that I was receiving. And it became a passion, and I never looked back.
So there's a lot of people that have misconceptions around what Chinese medicine is. How would you explain Chinese medicine in just a few sentences to somebody who's not familiar with it?
Chinese medicine is one of the oldest medicines that work with nature, and that means with natural substances like minerals, like herbs, like animal materials, but also with energetic fields, which were always played a major role in all ancient traditions, whether that was in Egypt or in Rome or India or the Mayans, etc. And so acupuncture, massage, certain kind of dietary things, those are all modalities, but they are basically based on a philosophy of living in harmony with nature. And nature is called 自然 in Chinese, which means that which is self-so, so that which is infinitely intelligent and that cannot be improved upon, and that you shouldn't therefore mess with. And
Self-so?
Yes, 自然 means self-so. So nature is the highest instance, even over the Tao. And it is that cannot be explained, but that all the secrets are in there. And that's why Taoism as the main Chinese life philosophy is sort of like, has inherently in it sort of a deeper respect for nature, that really all ancient traditional systems have. Chinese medicine is a truly holistic medicine from that perspective, that does not only look at the matter reality that we define as being what we call science, is limiting reality to matter, but is recognizing that matter that is all around us, but that's only 0.0001% of the universe, is governed by energy, or what we call qi in Chinese medicine, or all this bioelectric reality that I mentioned to you, which is further governed by consciousness. And that is perhaps the most important thing, is not only in ancient medicine that has practiced from that perspective for thousands of years, but it is a medicine, an indigenous medicine, a holistic medicine, ancient medicine that is still alive today. A lot of other, like Native American medicine, for instance, same principles, but it wasn't written down by some, as you had in China, some imperial decree that we want to keep that knowledge of the wise people in the mountains and recopy it over
That's
generations.
actually my follow-up question is, how long has Chinese medicine been practiced and documented?
There are many, many different traditions, and the tradition that I was originally trained in by my teachers in China is the Shanghan Lun tradition, which is a classic written about 200 AD, about 1800 years ago. And there has like several hundred, 300 or so plus formulas in this book from that time. And in my clinic, I mostly use still, of course, slightly modified form. I use those remedies from that time. So that is the genius of that medicine, is that something was that perfect at that time, like this alchemical tradition of recognizing not only what a particular substance does, but what happens when you put 7 or 9 or 12 substances together, how they work together to adjust the disturbed energy field of a person. And while in Western medicine we have a new Merck manual every year, and the truth of yesteryear is changed this year, and we go like, oh, that was so barbaric what we did 5 or 10 years ago. We have a tradition here where, for the most part, we're using still what people used 1800 years ago.
Well, just in a sentence, what do you love about this practice of Chinese medicine?
From a very selfish perspective, it never gets boring. The profession of Western medicine supposedly is practitioners therein. There is the greatest rate of depression because you have such high demands and such great intelligence to get into that field. But then when you are done, it is very prescribed, the standard of care. There is no creativity. You go by the book. Otherwise, you get in trouble with the insurance companies. If you veer to the left or the right, I mean, during the 1980s, as an MD prescribing vitamin C, that was enough to get you into trouble. Whereas in the profession of Chinese medicine, every patient gets treated as an individual. So every patient is like a detective case, and you need to be fully present, and no two people get treated the same. And that makes it more difficult, but it also makes it never becomes routine. And I find that not only the philosophy of nature behind it, incredibly intellectually stimulating, and I find it's just as much as a science as it is an art. But instead of working in the ivory tower at Harvard University or so, I'm helping people every day with this very interesting and stimulating philosophical knowledge that I can use in actual practice, and that makes me more happy than anything else.
That's cool. I wish I had known about Chinese medicine about 20 years ago. Because I've always been fascinated with medicine, but I didn't know about Chinese medicine. And I slowly kind of came into it. Of course, when I met you, I learned a lot more. So you've said to me that Chinese medicine doesn't leave any part of the person behind. What does that mean, and how is it different than Western medicine?
The model of Chinese medicine was theoretically already sketched in the view of reality that was spelled out in the I Ching, which is not only the book of change, but also basically based on the reality that the only thing we can safely assume that nothing always stays the same, and what is true today might be different tomorrow. But also, I Ching also means the book of symbols, and so the whole I Ching is a symbolic description of reality, and using some symbols, whether in graph or pictogram form, to describe reality. And reality is divided into 5 different parts that they call the Tao layer, the Qi layer, the symbol layer, the shape layer, and the 3-dimensional space layer. So there is that, in a nutshell, again, this kind of 3 division from matter, energy, consciousness is further fleshed out into 5 different layers. So it means holistic medicine, or Chinese medicine, as an excellent example of holistic medicine, doesn't just look at matter, but it looks at the energy that not only is also there, but that governs and informs the shape and the behavior of matter, including the matter of our physical body, that Western medicine exclusively looks at, without regarding the energy that governs that matter. And then furthermore, it doesn't stop there, the consciousness that furthermore governs that energy layer. So when we look at the human being, in our diagnosis, we need to not just look at the physical layer of the body and the tumor and the moles and the skin problems, etc., but find a way through pulse diagnosis and symptoms and to assess directly or indirectly what the energy behind these material phenomena is, but then also consider the spirit and the state of consciousness of that person, and ideally aim in the treatment to affect the person on the highest rather than just the lowest level, because that is that hierarchy: consciousness governing energy, energy governing matter.
And it seems to me too that in Western medicine, it's not only that we're only addressing matter, but we're addressing parts of the matter. Like, it looks at the individual, like there's so many subspecialties in Western medicine, right? So it never looks at the whole body as a whole.
And that is a whole nother, from my perspective, that's another huge difference between modern science and particularly medicine and orthodox medicine and the holistic medicine, especially Chinese medicine, that you do never look at just one part in the body, because ancient people already knew that, of course, they didn't have any electron microscopes or so to peer into the details, but even if they could have done that, they would have chosen not to, because they know that the important thing is how different parts of the body cooperate with each other. There was a Nobel Prize winner about 30 years ago, I forget his name, but he went through the exercise of calculating if you would write down every chemical reaction in a single liver cell in a single second, it would take a human being 100 years without sleeping to read through all these formula. So the layer of complexity in our body is unfathomable. It's incredibly complex, and the idea that there is only one molecule, like cholesterol or so, that is going awry, and we take some pill and we affect that, whereas in Chinese medicine there's multiple ways of, what you really after is increasing the cooperation between different organ networks in the body. I just a couple of days ago listened on the radio to something research about some mice or rats or so that pair for life, and where they thought for sure when they first get together there must be an explosion of oxytocin, the bonding hormone, and they didn't find anything of the sort when they started to build nests together. And the conclusion was there is not just one molecule, but there's multiple pathways to achieve something. So we have this kind of monodimensional way in science in general, but particularly in medicine, and we looking at the body like this simplistic machine when it's really the most sophisticated organism in the universe that has many, many layers of complexity. And the important thing is have things work together in harmony rather than just operate on or suppress or manipulate just one single point in the body.
Yep. So if the body should be seen as a whole, what about the body, mind, and spirit? In Chinese medicine, can we heal one without healing the others?
Very briefly, no.
Perfect.
No, because of
They're
everything
so
we've been
You've already
talking,
talked
they are
about
connected.
The energetic, the consciousness.
It is, yes. The body's a web, and those things, they work together. And the mercy of holistic medicine, particularly Chinese medicine, is if somebody comes with a psychological problem like anxiety or depression, I don't need to be a psychologist, but I can support you herbally or even with acupuncture and dial in whether you even believe in it or not, and change something physically that then literally has a heart-opening experience, and you are now much more ready to do your psychological or spiritual kind of work.
So you have a sign in your office that always catches my eye that says Allah, which means God in Arabic for all religions. How do you feel spirituality or divinity fits into healing?
So-called religion is the science of working with that consciousness level and the spirit level of the human being. And every tradition has its own entry point into that. There's not a single one where there was Stone Age mammoth hunters or traditional Middle Eastern or Chinese or Indian or Mayan or whatever tradition we take, that there wasn't the connection to the spirit world and the recognition that we are not just matter, that we're not just energy, but that we are spirit, and that human spirit longs to connect to the intelligence that is in nature and that is behind all of that, is in a certain way the human mandate from that perspective. So I've studied with Sufi teachers, that's where the Allah comes from. I've studied with Buddhist teachers, with Taoist teachers, I grew up Catholic, so those are all different ways to reach the same goal, namely cultivate the human spirit in a Gnostic way, not kind of belief in some dogmatic, if you being a good boy in the afterlife, something. But there are certain, working with posture, with breathing, with sound, etc., with light. Even in the Catholic Church, you're in a cathedral and you see like the light being filtered, you play the organ, you're on some kind of a ancient power spot. After an hour, you leave that place, you feel different. So you had sort of an energy bath in that is fine-tuning your own vibrational reality and make you feel different afterwards. So rather than separating science and religion, that's really what all ancient medicine did, is they looked at it all as one, as both art and science and spirituality.
Two questions. How do you define healing in just like a sentence or two? And then how does Chinese medicine give the body the support it needs to heal itself?
Healing is something that the body knows how to do itself. Therefore, 自然, our body is part of nature. And in the healing process in holistic medicine, you always want to stimulate and help the body to heal itself, rather than thinking, I know something better and your body is scary, just like nature is scary, and therefore I need to shut something down in your body, and I put a kind of screw into your leg or something like that. But that is sort of an example of what we're trying to do, not just with Chinese medicine, but I think other kinds of holistic modalities, is help the body recover its own ability to heal itself, because we can't do it any better.
Yeah, there's like wisdom there. There's knowledge there that we just have to trust. Chinese medicine takes food very seriously. Can you say more about the role of food in day-to-day well-being? What should we be eating on a regular basis? Are there universal truths, or is it different for each body?
You like to open cans of worms there.
We talk about food a lot, me and you, so we might as well go there.
Two different things come to mind there. First of all, everybody is different, have different constitutions. Therefore, in Chinese diagnostics, the 5 element or phase element systems of diagnosing, and some people, they tend to have more wood problems. Other people have more metal problems. The most important thing with the food is that the same thing in the food, there is matter that we focus on exclusively in modern nutritional science. Namely, there is vitamin C in an apple, there are these sugars in the apple, and then we have a food pyramid and how many percentage you have that. So we, like King Midas, we touch that, and all we see is that apple is just a bunch of different chemicals. We might as well put that apple into a tube, and that's what we do when we send astronauts into outer space. This is all you need. You just suck on that tube. It's the equivalent of this apple.
We don't think about the energy.
We don't think about the energy or even
just talking about the food and what we put in our body. Obviously, when patients come to see you, they're not only getting herbs, they're not only getting acupuncture, there's a whole bunch of things that you pull from. And one of them is, giving them a protocol of what they should eat or not eat. So in looking at all that, how can you tell that a patient's improving? When they come, they come to you the first time and then they come to you a few months later, how can you tell that they're improving?
Yeah, that's a very good question. In the matter-oriented model of medicine, the diagnosis is always about something that happens in the material plane of the body. Namely, is there something wrong with your blood picture? Are your liver enzymes elevated? Is your cholesterol elevated? Are there any structural changes in your organs? Like, do you have cardiomyopathy? Is your heart enlarged? Is your liver enlarged? If not, and you just have a whole bunch of symptoms, then the diagnosis is you really have nothing. You're completely healthy. And maybe I could send you to a psychiatrist, which means then all of a sudden it becomes a psychological problem, which is not even talked through nowadays anymore, but is medicated with some of the strongest kind of chemicals, which very often tend to have more side effects than benefits. In the Chinese approach, in the holistic approach, the symptoms of the patients are symbolic windows into the energy of the body. So you never kind of go like, oh, I'm not interested in that, but you're specifically interested in not just do you have a fever, but do you feel cold or you feel hot. In the hospital, if you have a fever and you feel like you are ice cold and you're asking for another blanket, they will, in the emergency room, will invariably put you into, pack you with ice. So we are particularly interested in the symptom picture. And when the patient comes back, we are mostly interested in how are those symptoms changing. Do you feel more energy? Are you sleeping better? And do you have more hope that there is light at the end of the tunnel than before? And very often those symptoms, because it's not us trying to pull some lever and force the body to do something, the body has its own priorities. So sometimes the patient comes and says, my nose is running all the time, it's really, really bothering me. I'm a TV announcer or something like this, and it's influencing that. And then the next time they come back and I say, how's it going? And they might say, well, nothing is happening. My nose is still running like before. I said, anything else changed? Well, I used to have diarrhea and I don't have diarrhea anymore. And they might not have even mentioned it that before. So the body has its own priorities of how it wants to heal itself and what is more important. And so then, of course, there are other signs like color in a person's face, light in the person's eyes, and very importantly, the pulse in the profession of Chinese medicine is a very old science in seeing how the pulse is. We're not counting beats so much as what is the vitality of the pulse. What is that's sort of a direct window into the vibrational quality of the energy that resides within a person. And so is the pulse more energetic and full and, less deficient than before, for instance.
So when I look at your life, I see somebody who is so vital and rooted in their daily healing practices, but also someone who can enjoy something like a glass of wine. There seems to be so much polarization out there in terms of what to do or not to do to feel better in our bodies. Do you have a filter you see your life through that helps you make decisions?
The filter I like to employ is common sense. If it's part of a tradition, whether that's Chinese or Thai or European Greek. Or Greek, then to me that means that is much more important to follow than some modern newfangled insight. You should only eat raw meat, or you should only eat raw vegetables and no meat at all. Or what it is about, though, when it comes to food at least, is high quality. So like the wine I drink, the chocolate I eat, the tea I drink is always, from small plots where people are real crafts people who have high ambitions and pride with the quality of their food, rather than some industrial production with thousands of acres or so, which invariably means artificial fertilizers, pesticides, and low vitality.
I'm
exactly.
A good student, Heiner.
Yes. So yes, I drink coffee, I drink tea, I drink wine. I do all of these sinful things, but I consider them medicine. It's all about the right time, the right amount, and most importantly, the right quality. Speaking about wine and tea, etc., in a certain way, the most important thing for human health is community. University of Washington research study from 20 years ago, where they determined that poverty seems to be the most important factor for human health, but in communities where community is most important, like Hispanics, communities, that community bonding overrides the potentially existing poverty background. And so drinking wine is not so much about, of course, there are flavonoids and all kinds of things in it, also energetically, but it creates a similar vibration into the people sitting around the table. And then you talk to each other while you're on the same wavelengths, quite literally. And so whether that is in Taoist temples or Buddhist temples, particularly tea is being consumed so as a vibrational tool to make each other's spirits resonate on the same wavelengths.
Mm-hmm. Our life expectancy in this country has gone down. It's at 76 years old. There's so much happening in culture that's not serving us. And a lot of what you've brought up is how nature is so essential to healing. Nature is so essential. How do we remember, or how do we remind people this very important thing of kind of reconnecting to nature? We seem to have forgotten.
Yeah, we have forgotten.
And it's accessible. There's nothing more accessible than nature, right? You can go to a forest, you can go to a park, you can go to,
Yeah, when I started to study literature 40 years ago, there was already a poetry at that time where the moon hangs in the sky like a neon light or so. So nature was already more strange, and we're comparing it to something that is more familiar to us, namely technological artificial lighting. And now it's 40 years later, and I'm a university teacher teaching young people in their 20s. I have kids in the 20s and 30s, and with all of the technology and social media and basically being hardwired into your phones, that estrangement from nature is even more extreme. And I mean, I bring some of my students, they're students at a natural medicine school, and we are on the beach, and instead of in the summer being barefoot on that beach, they want to be in their sneakers because they're afraid that they're going to hurt their feet on the sand somewhere. And the fear of nature and the fear of our own bodies, that it could be doing something wrong, is a tremendous source of anxiety. And I think in my own case, what helped me also, particularly at the moment of crisis, that didn't make me run for the hills when I was very aggressively pressured. If you don't do this, you will be dead. Every regular person would go, okay, I'll do it, whatever you want. Was that from little times on, what my parents and grandparents instilled in me, not just when you get sick, this is what we do, but every weekend taking a hike, going skiing and hiking in the Alps as 9-year-olds already, summiting mountains that are 14,000 feet high, and just feeling that incredible vibration when you swim in the ocean and you are in the sun and you eat this, so hungry afterwards, you always feel so good. And so real medicine starts with agriculture, and real medicine starts with education. There needs to be a overall greater immersion and trust in and respecting and delighting and celebrating the natural world.
Mm-hmm. The thinking goes, as we age, we become less vital. But you're proof that that's not true. How can you share how we maintain vitality as we grow older?
Well, I mean, thank you that you say that, but I just get just as creaky as everybody else at my 60 plus years here. I'm a cancer survivor. I had myocarditis, inflammation of the heart muscle 20 years ago. So those are all life-threatening diseases. So I had to work hard to overcome them. But I think the most important thing is in the hierarchy, of course, eat whole foods and do exercises and breathe air that benefits not just your physical body, but your bioelectricity in your body. The most important thing is your spirit. Keep your spirit engaged and hopeful, and see every situation that comes in front of you, including disease, as an opportunity, that there is not a coincidence, but that the universe puts something in front of you, and that is your individual task to make it through that. And so rather than looking at that, the glass is half empty and I'm a victim, and why is this happening to me when everybody else is movie happy, this is they're in this lifetime, at this moment, this is your path to happiness, and embrace it. And that is what I learned most from my time in China, and from my not just medicine teachers but spiritual teachers, and I'm trying to follow that as much as possible. Yeah.
What are some healing practices you do every day to stay mentally, physically, and spiritually healthy?
Follow the hot shower in the morning with 30 seconds of ice cold. Skin brushing along the meridian pathways. Then, even if it is just for 10 minutes, I did an hour when I was younger, but move the body before I start my day with what's called Qigong practices, which involves certain movements paired with breath. It's a kind of a Chinese type of yoga, and sometimes as simple as just jumping up and down like you would, but then visualizing that I'm releasing any kind of tension or body's getting lighter. I live on 30 acres, privileged that I'm able to do that. And so I accompany my wife who milks our goats twice a day to the walk in nature, no matter whether it rains or shines, and as much as possible, or walk down to the sandy river.
I love that you milk your goats twice a day. That's amazing. All through all seasons, all the time?
All seasons except in the winter when they are pregnant, because then they need the extra energy to nourish their fetus, and then the milk will naturally also get less and less.
Wow. So before we get to our final question, is there something that we haven't covered today that you feel you'd like to share with everyone?
And don't imprison yourself with preconceived kind of notions. I think the biggest problem for modern people is that we think it's all about us and some kind of birthright that we need to be happy all the time and disease-free all the time. But adopt more of this kind of traditional, what I find in tribal societies, where it's about the community and what's good for the community. And that when we personally don't feel that great, rather than just kind of try and engineer something, either biochemically by taking a pill or getting a operation that might not be necessary, or lamenting how terrible we have it. Because even our thoughts have a positive impact. If consciousness is really the highest level, every thought we have will influence the field around us. And yes, we can go and demonstrate and be politically active and use our money to assert our power in the world. But really, from a spiritual perspective, the best thing is just have positive thoughts. And influence the people around you, will influence other people, and don't make it all about poor me all the time.
Powerful. Could you lead us through a simple 5-minute healing practice that you love or would care to share?
Yeah, okay, let me think about maybe, since we just talked about the shaking, let's just do that shaking, because that's the easiest to learn, and is, if I could only pick one exercise, as ridiculous as this exercise looks, it gives you the biggest bang for the buck, I think, and moves energy very quickly and can change even your consciousness reality within just a few minutes when you feel down or cold or depressed or so.
Cool. Yeah, and I've been sitting a lot today, so I'm happy to shake.
Let's do it, yeah.
Tell me. Stand up.
All right, so we start by putting our feet together and surrendering all of our weight to the floor and to the surrounding plasma of the universe, as if he's sort of floating in the ocean. And we particularly relax our shoulders and our neck, where we hold a lot of our nervous system tension. And then we take sort of a half a step to the right, and we inhale up with the heels, and we open up the heels outward a little bit. And then as we exhale, we come down and start shaking. And now we keep shaking, feeling that we're getting lighter and lighter, more and more relaxed, less and less heavy. But we mentally focus on the joint layers, where most of the acupuncture points are, and thinking that all of the joints are relaxing and being shaken loose. And then after a while, we shift our focus to the flesh and muscle layer, connective tissue layer, where all of the meridians are embedded in Chinese medicine, and where most of our heaviness and soreness is. So we're thinking looser and looser, lighter and lighter, shaking all of that heaviness, all of that fatigue, stagnation, boredom, whatever it might be, into the ground. That includes the muscles in the face. There are like almost 40 of them. And then we are shaking into the organs, starting at the top with the lung. We can take our hand and kind of clapping on it, almost like we're dusting off a carpet. It's going to influence the microphone, so I'm not going to actually hit my lungs. But so we would go lung, and we would go heart, and we'd go middle part of the body where the stomach is, and to the left to the pancreas and the spleen, and we go to the right to the liver and the gallbladder, and the intestines, and the bladder and the reproductive organs, and the kidneys. And now we go to the very top of the body, feeling the presence of the blue sky, and we're shaking down what is, in a lot of cultivational practices, the most important piece of hardware in our body, which is our spine. And we are shaking, releasing any kind of tension in our crown, the top of the head, and now going down the spine, vertebra by vertebra, starting with the 7 vertebrae in the cervical spine and the neck from the top. Sort of just kind of a distant focus, looser and looser, while we keep shaking the whole body. And then the thoracic spine in the back of the chest, 12 vertebrae here. And the 5 vertebrae in the lumbar spine, lower back. And our hip joints, and our knee joints, and our ankle joints, and our toe joints, and the bottom of the feet, and back up to the top. Blue sky, top of the head, and the neck once more. And now at the base of the neck, branching into the shoulders, where we bear so much weight and tension, and into the elbows, and the wrists, and the fingertips, and the finger joints, and every cell in the body, every place that's still tired or sore or stagnant, including anything in our emotional body, any kind of anger or blame or whatever other emotion, which is just, from a Chinese perspective, stagnant energy, shaking that into the ground. And stop. And just for another 30 seconds or so, we are completely relaxed, quiet on the outside, but still feel energy moving through our body, everywhere. Just stepping out of the way and letting every cell in the body do its work. Anything that needs to be discarded, let it be discarded, and anything that needs to come in, be informed, be nourished, let it be nourished. And then slowly, slowly opening the eyes. And you can do this for an entire hour, or you can just do it for 3 minutes between clients or between classes or so. And
Do you do this every day or several times?
Every day for 30 years or so, yes.
Wow, for how long do you do it?
When I do it with my students, sometimes on retreat weekends or so, we do 45 minutes and then we do another movement afterwards. But when I do it by myself, I sometimes just do 3 minutes between patients, for instance.
Wow.
But I do do it at least 4 times a day or so.
That's amazing. I mean, you totally feel the energy shift in your body. Thank you, Heiner.
Thank you.
If you enjoyed this conversation, please like, subscribe, and share with a friend. You can connect with Into Healing on TikTok and Instagram for more inspirational and behind-the-scenes content, and visit our website, intohealing.com, for transcripts and other goodies. Into Healing is made possible thanks to people like you. Contributions made through Venmo @IntoHealing or through our website, intohealing.com, help us bring you more inspiring episodes. This has been Into Healing with Mira Adura. Thank you for joining us.